Hello, Dr. Jamie. It's so nice to have you here today, and I'm excited for you to share some of your testimonies that you've had at Tummy Temple. But before we get into that, I want you just to give the audience your background, where you come from, what your specialty is.
Yeah, good morning. So I am a naturopathic physician of 14 years, Dr. Jamie Dowdy. I'm the medical director of the Tummy Temple. We specialize a lot in digestive health and cleansing and detoxification programs, and lymphatic therapy is a huge component of that.
Awesome. So how long have you been using this lymphatic therapy, the XBT?
Half the time I've been in practice for 7 years here. Yep.
What kind of results have you seen using this on your clients with digestive issues?
Of course, big improvements in pain management, energy levels. We treat a lot of complex chronic illness, and a lot of the time there are underlying immunological imbalances or viruses and infections that patients are battling, and the electrolymphatic therapy support is really key in improving their quality of life and giving them, again, better pain management and fluid management, and they just get a better quality of life.
Right. So have you noticed better absorption with the nutraceuticals that you're also recommending?
Oh yeah, I think it's really helpful for any type of leaky gut process, imbalances in the colon, in the bacteria and the flora that live there. Yeah, improvement in colon hydrotherapy sessions as far as comfort for the patient, and then the efficacy of that treatment, again, through the same mechanisms, just decreasing inflammation in the gut, which then of course would lead to better bioavailability of nutrients from food and then from supplements and nutraceuticals.
So how many therapists do you actually have now doing assisted lymphatic therapy at Tummy Temple?
My best guess is going to be about 5 or 6 lymphatic therapists and 7 naturopathic doctors using that too. So
yeah, you have a big clinic. I remember years back when I actually visited the clinic. Very impressive. Yeah, very impressive. So do you see any lymphedema patients?
We do actually. And what's so interesting is we notice this correlation with, again, like the chronic biotoxin illness patient, the chronic infections, they carry along a lot of fluid just in inappropriate spaces. And I can think of a woman recently who we probably did about a dozen electrolymphatic therapy sessions, and she was carrying like 25, 30 pounds of fluid, and a lot of it was lower extremity edema, and it was part of her Epstein-Barr picture, but that just completely changed her life. She couldn't walk more than 10 minutes without being so fatigued. Again, a lot of pain was part of her symptom presentation, and just like exhausted and just inflamed in her whole body. And you could just see it with how the tissues were just inappropriately managing like fluid dynamics through the lymphatic system, because that's the system that was affected by the virus.
I remember when I was in school, in nursing school, I learned very little about the lymphatic system. A little bit more when I went to school to be a naturopath. What about you? What was your background with the lymphatic system prior to?
Yeah, it was in the curriculum, but I think it was underappreciated and under-discussed, and even just your exposure in your clinical rotations wasn't, I think, sufficient enough to really have a good understanding. No, a lot of my own education has come post medical school. Yep.
Awesome.
Yeah.
Awesome. Yeah. So what would you say to other doctors or healthcare professionals about providing this type of therapy in their practice? Would you recommend it, or?
Oh yeah, absolutely. It's going to support any type of detoxification program, any type of immune dysregulation, whether it's the Th2 dominance that's so common in the atopic individuals with allergies and eczeema and styes, to, like I was saying, back to just the gut health. We've seen, the other cool thing is, just comes to mind, is we do a lot of stool analysis at Tummy Temple, and we often check secretory IgA levels in the stool. And one way that we've seen increase those is through focused electrolymphatic therapy. So that's pretty cool.
Yeah, that is great. Great to know. All right. Thank you, Dr. Jamie. I appreciate your time and look forward to learning more from you.
Yeah, you're welcome. Thank you so much, Dr. Jennifer. Have a beautiful day.